Well, in this video, we will discuss ankylosing spondylitis. So, what is ankylosing spondylitis? Ankylosing spondylitis is an inflammatory condition that affects the spine and sacroiliac joints. Other large joints may also be affected, like hip joint, shoulder joints, etc. But mainly it affects the spine and sacroiliac joints. There should be a radiographic evidence to label the disease as ankylosing spondylitis, because when we do X-ray, then we can see the bamboo spine. I will show you X-ray. There is pain and fusion of the vertebrae, and therefore the joint spaces are when lost, then the mobility of the spine is reduced. It is mostly started in the patients who have age less than 20 or in 20s, and males have more susceptibility to be affected by this disease as compared to the females. If we go to the signs and symptoms of ankylosing spondylitis, then there is backache that radiates to the buttocks. Furthermore, there is morning stiffness and backache that lasts for several hours. Several hours it lasts, and it improves with activity. That is, you can distinguish it from mechanical causes, because if you have mechanical trauma to the spine, then it worsens with the activity, but ankylosing spondylitis improves with the activity. Furthermore, when the disease progresses, then it progresses in the cephalad direction, that is, after involving sacroiliac joints, it goes in the upwards direction. There is also oligoarthritis, that is, it involves some joints which are large joints like hip joints, shoulder joints, and there is anterior uveitis that is associated with this disease. You can also see enthesopathy, that is inflammation of the tendons at the site of attachment with the bone, plantar fasciitis of the foot, and there is also some cardiac involvement that can result in AV blocks. Furthermore, you can also see pulmonary fibrosis in some patients, and also bronchiectasis can be seen. If you want to diagnose this disease, then you have to do some labs like ESR, it is raised. You will do CBC. You can see that there is anemia of chronic disease, but this anemia is not too much marked. Furthermore, there is an association with HLA-B27, and mostly 90% of the patients have HLA-B27 with ankylosing spondylitis. You can see here on imaging that the joint space is narrowed. You cannot see the gaps in the joint space. So you can also see that this is looking like a bamboo. This is bamboo spine. The differential diagnosis for ankylosing spondylitis are mechanical trauma, disc disease, and degenerative arthritis. Treatment. The first line of treatment is NSAIDs. For any inflammation, we use NSAIDs, and if NSAIDs don't work, then we give TNF inhibitors like Tofacitinib. Tofacitinib can be used in NSAIDs-resistant disease. JAK inhibitors can also be used in NSAIDs-resistant disease. TNF inhibitors are these are infliximab, golimumab, while JAK inhibitors are tofacitinib, etc. If the disease is resistant to these all medications, then we use monoclonal antibodies against interleukin 17A. These are secukinumab, and these are used when these all agents don't work. Furthermore, you should know that when you are using TNF inhibitors and JAK inhibitors, you should rule out previous TB because it causes reactivation of the TB. So this is all about ankylosing spondylitis. Thank you for watching.